Anxiety can cause many symptoms, including feeling emotionally numb or devoid of emotions. This video will give you a brief overview of the anxiety symptom emotional numbness and what you can do to get rid of it. Toward the end of the video, I'll tell you how I experienced emotional numbness, what I did to get rid of it, and why there is no reason to worry about it. So, let's begin. Emotional numbness is another common anxiety symptom. It's often described as feeling as if you are emotionally numb or devoid of emotion. It can also feel like you have no emotions at all, neither positive or negative. It can also feel like you are disconnected from your emotional self. And it's also often described as being emotionless or lifeless. Visit our Emotionally Numb Anxiety Symptom article for more common descriptions. The link is in the comments. Emotional numbness can occur occasionally, frequently, or all the time. It can also occur with other symptoms or by itself. It can also range in intensity from slightly noticeable to severe. It can also come in waves where you feel emotionally numb one moment and not the next. All combinations and variations are common. This symptom can seem more disconcerting when undistracted, resting, doing deep relaxation, trying to go to sleep, or when waking up. Before we explain why anxiety can cause emotional numbness, it's important to discuss all new, changing, persistent, and returning symptoms with your doctor, as many medical conditions and medications can cause anxiety-like symptoms, including this one. If you've done that and your doctor has attributed your symptoms solely to anxiety, you can be confident there isn't a medical or medication cause. So how does anxiety cause feeling emotionally numb? Well, when feeling emotionally numb is solely attributed to anxiety, anxiety can cause this symptom in several ways. For instance, number 1, the stress response and acute emotional numbness. Anxious behavior such as worry activates the stress response. The stress response prepares the body for emergency action to either fight or flee. The greater the degree of anxious behavior, the higher the degree of stress response. In addition to fighting and fleeing, some people freeze when afraid, especially when very afraid. Freezing can cause dissociation, which means feeling emotionally numb or detached from emotions. In this instance, high-degree anxiety and stress response can cause acute emotional numbness due to dissociation. Since stress responses push the body beyond its balance point, stress responses stress the body. As such, anxiety stresses the body. Stress is a common cause of emotional symptoms such as feeling emotionally numb. Number 2, chronic stress and chronic emotional numbness. When stress is chronic, such as from overly apprehensive behavior, the body can remain in a state of semi-stress response readiness, which we call stress response hyperstimulation, since stress hormones are powerful stimulants. Chronic stress can cause a host of chronic physiological, psychological, and emotional symptoms, including emotional numbness. As long as the body is chronically stressed, it can produce chronic symptoms, including this one. Here are a few of the ways chronic stress can affect our emotions. Hormones. Hormones such as dopamine, serotonin, and oxytocin play an important role in our emotions. Stress hormones can affect our emotional well-being, such as causing emotional numbness, since stress hormones can affect other hormones. The more frequently stress hormones are activated, the more impact they can have on our emotional well-being. Fatigue. Stress quickly drains the body's energy. Chronic stress can tax the body so much that it becomes exhausted. Fatigue can flatten emotions, making them feel numb. As long as the body is exhausted, it can feel as if we have no emotions. Fatigue can also be caused by recovery. As your recovery efforts cause a reduction in hyperstimulation, circulating stress hormone levels diminish, which can cause fatigue. Feeling exhausted and emotionally numb is a common indication of the later stages of recovery. Fatigue is a common cause of feeling emotionally and physically numb. Sleep deprivation. Chronic stress is a common cause of sleep problems. A lack of regular good sleep can cause sleep deprivation. Sleep deprivation affects the reasoning and emotional parts of the brain. Research shows the first signs of sleep deprivation are unstable and dull emotions. Sleep deprivation is a common cause of feeling emotionally numb. Behavior. Research has shown a tight mind-body connection. Since our emotions are primarily caused by how we think, and since the body's physical health can influence how we think, our emotions are caused by a complex combination of biological and psychological factors. Some of the psychological factors that influence our emotions include our beliefs, preferences, attitudes, how we behave, which means think and act, and habituated patterns of behavior. Dr. David Burns coined the phrase, "we feel how we think," meaning our thinking drives our emotions. If we behave in anxious and depressed ways, that can affect our emotions, including creating feelings of being emotionally numb. For instance, feeling down and blue or trapped and helpless can elicit feeling emotionally lifeless. These are just a few of the ways anxiety and stress can affect our emotions. There are others as well. For more in-depth information about how stress and chronic stress can cause this symptom, visit the Emotionally Numb Anxiety Symptom article. Again, the link is in the comments. And other factors. Other factors that stress the body can cause and aggravate anxiety symptoms, including emotional symptoms such as recreational drugs, stimulants, low blood sugar, nutritional deficiencies, dehydration, hormone changes, and pain, to name a few. For more information, there are links to these different factors in the Emotional Numbness article. So how to get rid of emotional numbness? When emotional numbness is caused or aggravated by other factors, addressing the appropriate factors can reduce and eliminate this symptom. When this symptom is caused by acute stress, ending the active stress response will bring an end to acute emotional numbness. When this symptom is caused by chronic stress, reducing stress, increasing rest, getting regular good sleep, and being patient will eliminate chronic stress in time. As the body recovers from chronic stress, it stops exhibiting symptoms, including this one. There are many natural ways to reduce stress, including regular deep relaxation, regular light to moderate exercise, cat naps, leisure walks, warm baths, having a massage, listening to soothing music, leisure swims, spending time in nature, and enjoying a hobby, to name a few. Visit our article, 60 Natural Ways to Reduce Stress, for more stress reduction ideas. Again, the link is in the comments. When emotional numbness is caused by behavior, addressing the behaviors causing anxiety or depression can restore healthy emotions in time. Working with an experienced anxiety disorder therapist is the most effective way to address the unhealthy behavior that causes issues with anxiety and depression. Emotional numbness is a common anxiety symptom. For instance, in an online poll we conducted, over 75% of respondents said they experienced emotional numbness due to their struggle with anxiety. During my 12-year struggle with anxiety disorder, I had many episodes of feeling emotionally numb. And this is on top of all the other symptoms I had, so when this showed up, I thought, well, what else is new? What else can go wrong? But this was unusual for me because, I was normally an emotional person, even during my struggle with anxiety disorder. So when this showed up, I was really concerned. I started looking for information about it and I couldn't find anything. And I concluded, surely this is a good indication that I'm losing my mind for good. I knew I loved my family. I knew I loved the things I used to do, but I felt nothing for them at that time. Absolutely nothing. Even watching movies and TV programs, I felt nothing, just flat, zero. So for me at that time, I was just, living my life by going through the motions, but emotionally devoid of anything. Over the course of time, I learned that, stress can cause a lot of things with your emotions. And so I eventually chalked it up to, again, just another symptom of anxiety and hyperstimulation. So I thought, well, you know what? I'm not going to stress about it. I'm not going to worry about it. I'm going to take my time, focus on getting my stress down, just ignore it for now, and hopefully things will turn around. And as I worked at my recovery, and as you know, I was faithful. Every day I worked at deep relaxation, calming myself down, containing my anxiety. And over the course of time, eventually my body started to settle. And as my body settled and recovered, my normal emotions returned. Now, I had episodes of emotional numbness. And what I mean by that is sometimes I'd have a week or a day or in sometimes even months just feeling emotionally flat. And then I would feel emotions again. And sometimes it would go the other end of the extreme where my emotions were so over the top. I would cry at any particular moment. I had numerous periods of euphoria, but then there was a time where I felt absolutely nothing. So as I, adjusted to my symptoms, got used to them, gave myself time to, gear down, body recover. And as I did that, those symptoms all cleared off, including the symptom emotional numbness. So if you're struggling with emotional numbness, I encourage you not to be upset about it, not to worry about it. Treat it as just another symptom of stress. And as you get your stress down, you'll find that your emotional numbness will lift too. So again, it's nothing to worry about. Stress reduction, containing your anxiety, and giving your body time, you will see the symptom lift in time.